I think that is important. Overall, we're not really sure exactly, though the DLQI asks specific questions, how a patient feels when their skin is clear, although the clinician would expect them to have a low DLQI because their skin is clear and they have relief of this pain and itching, it's not always, really correlated. And so I think that this study shows that this high impact of an effective biologic with low amount of itching, pain, and less scaling and durability shows that that does affect the quality of life and does allow these patients to have clear skin and a low DLQI. To me, that with terms of long-term data, now this is not looking at safety. This is looking at efficacy. And you would expect that if there was safety problems, the DLQI would be higher. So let's put that aside. Let's look at the clinical benefit. So what I like as a clinician that prescribes biologics for psoriasis is that I can feel comfortable with the data that is presented that over 3 years, you're going to have durability. The patient's going to continue to stay clear and continue to have a low DLQI, or in other words, a better quality of life. And because of this supports my use of bimekizumab in my clinic so that I can reassure the patients that studies support that even up to 3 years that they will have continued skin clearance and improvement of their quality of life that is sustained. Yeah, that's a hard one because, as I mentioned, patients that are on secukinumab can do very, very well, and there's still a great chance of a PASI 100 and a PASI 90. But compared to bimekizumab, that's where the difference is. And so those that were switched from secukinumab to bimekizumab had further improvements of their skin clearing, their itch, and their pain, and as well as their scaling by year 3. And so showing that persistence. Now, we didn't continue the secukinumab for 3 years. However, those that were switched had better improvement over time.